Canadian Association of Schools of Nursing and Canada Health Infoway, in collaboration with the National Nursing Data Standards Initiative and the Digital Health Nursing Facility Peer Leaders, are pleased to present the value of clinical data standards for nursing. I am a nurse and here to talk with you about clinical data standards. To begin, why are clinical data standards important? Concrete examples of clinical data standards in nursing include physiological and psychological assessments such as the Inter-I, interventions such as teaching and treatments, outcomes like function, symptom management, and readiness for discharge, standardized clinical outcomes such as CHOBIC. Let me tell you the story of Maria to show you why the use of clinical data standards matters. Maria is an 18-year-old woman who lives alone in a rural community. She has arthritis and COPD with some shortness of breath on exertion and walks with a cane, but is otherwise relatively well and still able to manage on her own. Maria is scheduled for surgery for a right hip replacement. Upon her arrival to hospital, I complete an admission assessment. In addition to other information, using the CHOBIC data standard, I document her limited function, that she has a high level of pain and fatigue, some shortness of breath, and the fact that she fell twice in the last month. I use my knowledge, skill, and clinical judgment to develop a plan of care for Maria and determine her ability to manage on her own post-discharge. She has her surgery and is now being prepared for discharge. The physiotherapist has provided her with instructions for stair climbing and daily range of motion exercises. With her daughter present, we again review her function, her symptoms, and her readiness for discharge. I am able to easily compare these findings with those I had documented at the time of her admission. I show her that while her pain and fatigue have decreased, her function has diminished somewhat, but will improve over time. We discuss her follow-up care, including a referral to home care to have her staples removed the following week, and follow-up appointments with the orthopedic surgeon and her family doctor. Maria will be able to care for herself with some assistance. While she still has some fatigue, her dyspnea is no worse than on admission, and her pain has decreased. I have all the information I need to share with the visiting home care nurse. 1 week after returning home, Maria is visited by a home care nurse. This nurse uses the same data standards measurement tools, allowing for valuable comparisons. When completed, the nurse discusses her progress with Maria and her daughter, showing her that her function is improving, her pain is further decreased, and she is much less fatigued than when she first went into hospital for surgery and since discharge. Her dyspnea remains about the same. Two weeks later, she has a follow-up visit with her family doctor. He reviews her function, symptoms, and outcomes, comparing them to other patients of her age. And congratulates her on her progress. So why use clinical data standards to document care? health system performance needs to be evaluated on the basis of more than an accounting of how many, at what cost, and where. A true evidence-driven healthcare system should be about what, by whom, and of what consequence to Canadians. Why should we use clinical data standards in nursing? Standardized data can be trended by diagnosis for individuals and for populations. Standardized data can be shared among clinicians and can be consistently used in communications with patients and families. Informing their expectations and understanding. Data can be aggregated, analyzed, shared, and compared, and trended over time to inform future healthcare decisions. Clinical data standards can help us to understand the impact of changes to nurse staffing models. The impact of nurse-patient ratios, and determine whether changes have an impact on clinical outcomes. Clinical data standards support the continuity of information as an individual moves from hospital to rehab, to long-term care, or to home, thus continuity of care. Clinical data standards help to support the delivery of safer, quality care, inform health policy, funding requirements, health human resource planning, and improve health of Canadians. A standards-driven approach to clinical care documentation will more effectively inform the evaluation of the quality and impacts of clinical care across the country.